Good morning, everyone, and welcome to our meeting.
Morning. Morning.
Today is April 1st, the beginning of Maternal and Child Health Month. We will now have our invocation by Rotarian Sherelle.
Good morning, everyone. Let us all bow our heads in prayer. Oh, Heavenly Father, that God in heaven, we thank you, God, for this holy week that we're going into. We ask, God, that you guide us and protect us as we go through each and every day. We ask for your protection and your courage as we bless your holy name through this holy week. In the name of Jesus Christ, I pray. Amen.
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 Loyal Toast, Rotarian Alex.
Good morning, everyone, to the Commonwealth of the Bahamas.
To the Commonwealth of the Bahamas. Welcoming of visiting Rotarians and guests, Secretary Donette.
Good morning, President Francis and guests. Welcome to another sunrise morning. Let me start with our visiting Rotarians. I see PP Kimmy all the way from Turks and Caicos. Hope you had a great flight here. Welcome to our meeting as usual. I'm not seeing any other Rotarian. Yeah, PP Derek was really early. I almost thought he was one of us. PP Derek, welcome as usual. I'm beginning to feel like you're a part of us, you know. Unfortunately, dual membership doesn't work. But we welcome you again this morning. And welcome to our Rotaractors who are here. Lauren Adderley from Rotaract Sunset, our partners in Rotary, welcome to the meeting. I'm seeing iPad and Galaxy A20, not sure who you are, but welcome to the meeting. Hope you enjoy it. If you're a guest, please enter your email address and the contact information in the chat so we can keep in touch with you and invite you to future meetings. We also have some guests. I'm not sure if they're part of Dr. Cooper's entourage, but we had some guests and they may be guests of Rotarians, and I will open the mic first for persons who invited you here to welcome your guests. If you invited someone to the meeting, please go ahead and welcome. Also remember to mute your mics when you come into the meeting. It should automatically mute you, but somehow I don't know what happens some mornings. So are there any guests of Rotarians? All right, let me then go ahead and introduce or welcome our guest speaker, Dr. Cooper Trustham. We're looking forward to your presentation this morning. And I know she had a guest in the name Tara DeVoe and Brenda Kerr-Enfield. Welcome to both of you ladies. Also, let me welcome JB. Not sure who JB is, but I saw JB enter the room. Welcome to the meeting. And if possible, please enter into the chat your email address and a contact number so we can keep in touch with you. Dr. Grant Taylor, prospective member, welcome to another meeting. We hope you enjoy the meeting. And I think Tara is a teacher at C.W. Sawyer Primary. And so we welcome you and hope you enjoy the meeting. So I think that's it for our guests. So let me just again welcome all our Rotarians and all our members from Nassau Sunrise. Oh, and I saw my guest just come in, Farah Johnson from the Tribune. Welcome, Farah. Glad you were able to join us. And I think that's it for visitors. So welcome everyone. Do enjoy the meeting. Back to you, President Francis.
Thank you, Secretary Donette. And now we will have our Sergeant at Arms take the floor, Rotarian James.
Good morning. Good morning. April Fool's Day. April Fool's Day is canceled. So y'all could keep your joke to yourself, okay? And this whole year has been a joke so far. So let's cancel all the jokes and call, and fellas say, let's call today March 32nd rather than April 1st, because this joke thing is going too far. But anyway, welcome to you all. Welcome. It's so good to be alive, so good to be here. I wasn't able to do anything last week, but I'm sure the venerable treasurer had to find everybody, right, Madam President? Yeah, she should have. I think I saw that
can't
in the chat.
confirm that.
Yeah, everybody got fined at
Able to
least $2 or
confirm.
$3. Happy dollars, misery dollar, whatever you want to call it. And I wasn't here. That was the meeting after the social. And that social was really, really good. But I have one bone to pick with Dawnette. Dawnette, you were the most gracious hostess around. I must give that to you. However, I don't know if y'all fellas know, but Dawnette wrote me offline and she said, I don't want to be a snitch, but I want to tell you what happened to all the stuff that you brought. Okay. Now, she says she ain't want to be a snitch, but then she was being a snitch. So, you know, you got to pay for that. Right, Dawnette?
Oh, gosh. You see, you set me up now. Nobody's going to want to come back to anything I invite.
Oh, yeah? No, man. No. In fact, I want you to think so that we could all come back next week. No. Don't fool yourself now. I really enjoyed myself. And I hear that some fellas put alcohol in my sorrel. Leroy, that's what you did, Leroy, my good friend Leroy. Put in vodka. All right. Antonio, Leah Carla, Patrick, Madam Treasurer, write down these names. Leroy, Antonio, Leah Carla, Patrick, Kemi, all decided that my sorrel need disinfectant. So,
but Father, you out us and we supposed to be drinking during Lent?
That's what I know. You ain't supposed to be drinking during Lent. But obviously you did. So y'all give $3 for that, please. Everybody could give a happy $2. Then these wine and liquor and Kemi, Jack Daniels. I mean, I like Dawnette, you know. He was so specific.
I am fine. I am happy to pay my fine as long as Father P also pays his fine for trying to give me diabetes.
Yeah, but that's why you put it in it. You could add a little something. Well, obviously you added a little something. Patrick, you put rum in yours, and Leah Carter. Yeah.
Father, just correction. Ain't nobody put no rum in the sorrel. They put the sorrel in the rum.
All right, give me that. Give me $2 for that smart comment. Who is that now? Anyway, that was really good. All right. Talking about, well, I'm going to rum keep. People say, if I could drink up all the rum, I say, not quite. When you get talking about liquor, I'm sure that my favorite story about liquor is I'm preaching one time, or the preacher was preaching and trying to talk about the evil or what is so terrible about this alcohol. And, people like for you to do a demonstration. So what the preacher did, he said, my brothers and sisters, I want you all to see this alcohol. I want you to see this. So he took a glass, I'm sure you've heard it before. You took a glass of water and he had this worm and he put the worm in the water. Say, brothers and sisters, you see this? When he put the worm in the water, the worm just danced around, no problem at all. And he said, now here is this glass. This glass has gin in it. Looks just like the water. But I want you to see this thing. And so he put the worm in the gin. Right then, the worm, boom, stretched out, dead. He said, my brothers and sisters, what does this teach you? The old woman at the back said, Father, when you get worm, take gin.
All right.
God bless you all.
Thank you, Father.
Okay. Pay your fines.
Thank you.
All right.
There are no birthdays this morning, announcements this morning. So we'll move right into our announcements. PDG.
Good morning. Good morning, everybody. It's my pleasure to speak to the 20th anniversary celebration. As you know, the club was chartered on May 8th, 2001. And so this May will be our 20th anniversary. We're producing a 20th anniversary booklet, proceeds of which will go to a special fund to support the educational fund at BTVI. We're asking all members to please support by taking out an ad or page or whatever you can afford in the booklet, to also speak with family, friends, and business colleagues so that we can get the maximum support in this venture. If you have any questions as to how you should do that, you can speak to the president or to myself, and we'll be happy to guide you through that process.
Thank you, PDG. Rotarian Kemi. Any updates?
Sorry, not at this time right now.
Thank you. Rotarian Patrick. Any update on the vaccine program? What is happening?
Good morning. We just need some more volunteers. We need more volunteers. So anybody that's able to volunteer or know someone that can volunteer, can you please let them contact me or President Francis so we can have them sign up so they can start volunteering. We need more volunteers. Thank you.
Thank you too. Are there any further announcements?
Yes, President Francis, let me just use the opportunity to announce our raffle this morning. So this morning we're having 3 raffle prizes. It's a holiday weekend and we feel very generous. So the first one is an Apple Watch dock. So if you own an Apple Watch, or even if you don't own one yet, you can buy the dock first and then buy the watch after. So that's one. And then there's a little gift from John Bull. I'm really not sure what's in it, but we have a gift from John Bull. And we have some Starbucks vouchers. So please, the raffle is 1 ticket for $5, 3 tickets for $10. So if you're interested in the raffle, just put a note in the chat and we will contact you after the meeting and tell you how to pay for your raffle ticket. But please, if you don't have a ticket, you don't have a chance. All right, so please enter your request in the chat and you can win one of these 3 lovely prizes. Thank you.
Thank you, Secretary Donette. Any other announcements?
Yes, and one more. Next week meeting is a closed meeting. It's our business meeting. And I'm just to apologize to our guests in advance. It's for the members only. So just note that in your diary. We will be doing our financial update as well as a vote on some amendments to the bylaws. You'd have received an email from me with some proposed amendments. Some are cosmetic and some are more fundamental amendments. And so we'd like everyone to be at the meeting. We need a quorum so that we can vote and have the votes carried. So please note next week, Thursday, business meeting, and it's for members only.
Thank you, Secretary Donette. Now we'll ask.
One more, Latoya.
I'm sorry?
No, I was asking President Latoya about the blood drive. She wants to speak to that.
Good morning, everyone. Present at the moment, sorry.
Morning.
But yes, we are hosting a joint blood drive on April 17th. Yeah, with Marine Corps Knockout Sunrise, the Rotary Club of Old Fort, and the Youth Conversation about South Ocean. So we will be volunteers with and also physical donate. So we like you guys to spread the word.
Thank you, President Latoya. And now we'll ask Rotarian Simone to introduce our guest speaker, Dr. Cooper Trustham, who will speak on maternal and child health.
Good morning, everyone. It's my pleasure to introduce this morning Dr. Trustham Cooper. She is a family medicine physician who is fully committed to promoting wellness and preventative medicine. She chose family medicine because she enjoys treating the whole person as an approach to wellness care. Dr. Trustham is married and has 2 wonderful sons, and she received her education at St. Anne's School, Macalester College in Minnesota, USA. She attended medical school at the University of the West Indies, St. Augustine campus, and her postgraduate studies at the University of the West Indies in Mona and the Bahamas. She has practices at both the Department of Public Health and medical concierge services in the Bahamas Arts Center building. We warmly welcome Dr. Trustham this morning to our meeting to speak to public maternal and child health in the Bahamas. Welcome.
Thank you, Rotarian Simone.
Just before Dr. Cooper starts, I Ms. Simone Bone, yes, that's a fine of $5. It's Macalester College. That was a horrible pronunciation.
Oh,
My
sorry.
I forgive you, Ms. Bo.
Thank you very much,
all.
Mr. Sergeant at Arms.
Good morning, all, and thank you very much so warmly welcoming me this morning. I want to introduce myself a bit further, as Ms. Bo mentioned that I'm a University of the West Indies graduate for my medical training and postgraduate training. Post-internship, I joined the Department of Public Health. So I've been in the public, though I've only been practicing since 2008, the entire time has been as a public health physician. And thank you, Officer Jones-Kemi, for inviting me, because I think I can provide a unique approach, because I am fully public health and I have served in the community through public health in maternal child health and adult medicine. I served as a district officer in 2008 for just 9 months, heading Exuma Keys and Ragged Island, but I also served as team leader at Fleming Street and Flamingo Gardens, as well as physician in charge at the Marsh Harbor Clinic in Marsh Harbor, Abaco for 2 years. That's pre-Dorian. To put things in context, I was asked to talk a little bit about the structure of public health. For some who are not familiar with the government system, that can be a bit daunting. So this is an oversimplified version of what public health does in the country and how it is and how it's a foundation in our healthcare in the country. Public health is responsible for health promotion. We have surveillance, research, epidemiology, and the community health. And that encompasses national coordination for disease surveillance for maternal child health, school and adolescent medicine, reproductive health, public health nutrition, health planning for the country, oral health services, and then, of course, as you could tell from my history, that ever important Family Island Health Services and Health Administration. So what that means is public health essentially is responsible for the community clinics, staffing, and of course, running the programs and the services in the community clinics throughout the Bahamas, not just New Providence. Recently, family medicine has been added to Elizabeth Estates Clinic. And the difference is that they are under PHA, which is Public Hospitals Authority, as opposed to DPH. There has been talk over the years for some more unification of both. And as you may guess, that they are both intertwined and intermingled. For example, PHA or hospital physicians may run high-risk clinics within the public health clinics concurrently with our maternal child health services or our gynae women's health reproductive services. So daily we're coming closer and closer to intermingling both and making it more of a seamless type of service for our communities. So I just want to, now that I put things in context, I just want to talk a little bit about what Mr. Jones asked me, because maternal and child health is a very broad topic. So he wanted me to briefly touch on the strengths pre-COVID and challenges pre-COVID and post-COVID, and what are some of my personal experiences in administering maternal and child health in the community setting. As you may all be aware, and any of you who may have visited the community clinics, there's always large numbers of patients at the clinic. And they are, I guess you can say they represent both our strengths and our challenge. Our strengths, because prior to COVID, I think we were, as we have been over the years, working strongly in diversifying our services, offering a large amount of services. We had a great immunization program, child health services where you can see physician, nurses, expecting mothers could see midwives. There were pharmaceutical services within the government clinic where children could get drugs for free. And that is all level of drugs, including over-the-counter drugs, as well as prescription drugs. And there were health promotion programs that were increasingly being given. So for instance, there were classes that were specialized in parenting, breastfeeding classes. You had appointments as well as our regular in-clinic teachings while you waited. More recent, prior to us having two events, which you can all remember, we all know that what has happened to us recently, I would say some of our strengths in that we were having increased staff and more physicians actually were joining public health or being asked to join public health, where we had more manpower to provide support. For example, previously we would only have a physician at certain days in certain clinics providing well visit and sick care. But because we had more physicians joining public health, we had a team that could conduct and administer services, as well as more physicians joining planning and more physicians being involved in health promotion and being involved in breastfeeding classes where the midwives and nursing usually took the lead. I can personally say at Flamingo Gardens and at Fleming Street, there was a program of teaching in the mornings where we had a roster providing patients with information about breastfeeding, child health, managing coughs and colds, also providing guidance of where they can access free government services. Why am I speaking in the past tense? Because some of these things have changed, and I'll touch on that later post-COVID. The challenges during this time, as we all know, was space, as well as overcrowding. And so the overcrowding was managed. However, it created some longer wait times that could be a deterrent for some parents, and as well as shortages in the pharmacist shortages, which also was a deterrent sometimes, because if we talked about what was needed, provided prescription, sometimes patients became a little impatient when they had to wait or had to leave our services to get their medication. There was also space issues. Because we were providing all of these services, particularly at Blue Hill Road Clinic, it became very cramped. And some of our buildings we had started to outgrow. And this has been happening over a period of years. Post-COVID, I should even say post-Dorian, we had a redirection of staffing and manpower to assist in alleviating some of the pressures from Dorian, and then soon after from COVID. The clinics went into emergency mode, and we have been in emergency mode for the past year. What does that mean? We didn't run in the same manner that we usually run. A lot of cases were triaged into non-urgent and urgent, which is not ideal because you're coming into the clinic to deal with the entire person. You're coming into the clinic for us to deal with those nitpicky things that you wouldn't want to go to A&E for, to talk to parents, find out how things are going, to have those nice well-child visits where you monitor a child's growth, where you are the person to first intervene in any issues in development, in any potential long-term health complications. And those services, I could say, were limited. More so in the early stages of COVID. Now, as we're slowly reintroducing, we still have the well visits, but again, the overcrowding issues because of the redirection of staff. My biggest disappointment is that we could not provide the psychological support and the health promotion that we usually provide post-COVID. For example, that offering an organization of health classes, parenting classes, breastfeeding, teaching parents how to monitor upper respiratory infections, coughs and colds, nausea, vomiting at home, and what not to do. Promotion of appropriate health for children. School health, of course, had stopped. So though we had school health nurses, that was a large area in public health where we promoted health and were able to get at a large chunk of our child health community. Specifically maternal health, health promotion in terms of what to do during the pregnancy and promoting good nutrition during that pregnancy. All of these things were completely lost during that COVID period, and we were providing basic care. However, our health promotion that was done in the clinic were limited to that short period that we had contact with the patient. We were limiting patients coming into that waiting area, which was a very good time for us to provide health promotion and supportive services and direct persons who may not even remember to say or ask questions when they come in to see the midwife. The classes were lost, the parenting classes were lost in terms of motivating patients to come in and to take advantage of these things. And truthfully speaking, although we had pamphlets and reading material, we find that that sort of passive health promotion was not as effective as our active health promotion of actively face-to-face teaching and encouraging persons to focus on wellness and focus on child health care. So those were our greatest challenges. Kemi also asked me to touch briefly on what would be required now post-COVID and what are some of the things that can be done to improve. And I think it speaks for itself. Psychological support and access to health promotion and questions, as well as financial support. We have had an increase in numbers in our maternal and child health registrations. Persons have switched from private services to public services, and we have had a loss of one of our major centers, which was turned into the COVID center. So South Beach was one of the major centers that provided maternal and child health, adult health, vaccinations. Their numbers were large, and those persons were redirected to either Elizabeth Estates or Flamingo Gardens Clinic. Since then, there has been a loss in their what we call continuity of care, where their files and the history of that patient, we now had to go back into and attempt to give that patient some sense of normalcy when they came in to access care, even though their regular clinic, and some of them even had regular doctors, was no longer there. And so there's been some anxiety regarding that. So we have three things. We have we have a redirection of patients, anxiety. We have persons who have been redirected to clinics they're not familiar with, and then they have been redirected to clinics that are now a lot more crowded than they would have expected. So that right now, post-COVID, you can say is our biggest challenge. In terms of maternal and child health needs, the psychological support, we are slowly and surely, as we get closer to normalcy, reestablishing those health promotion programs, in clinic teaching, as well as learning where to direct patients. Our numbers briefly, I do not have the official numbers, those are done formally, but I can say briefly in terms of the maternal aspect of our care, we register, you can grossly estimate about 300 patients a week, and that is just at the Flamingo Gardens Clinic, all right? So that is pretty large number. And I think the midwives do an excellent job of managing those patients and ensuring everybody has access and has the perception of being access at any time. And that includes ambulatory services where pregnant women can walk in when there is no maternal clinic running and see a physician at that point. So what can be done? Dr. Jones, not Dr. Jones, Kemi mentioned that you have some sort of drive to provide assistance, and that assistance can come in the form of financial assistance. We have a list of mothers coming into the hospital, and at the back of their registration form, we tell them, here's what you need. We need assistance with that. We also need assistance with mothers. I guess you could also list where they can access care and where they can have their questions answered, and also where they can access live parenting classes, live breastfeeding help, lactation counseling, child health, what to do when, and how to get these medicines and access these medications. So overall, I feel like the direction of child health care, although we have taken many steps back because of our manpower and the structure that is already there, we're moving forward in a good direction, particularly as the country gets immunized, we move closer to normalcy. We're moving more towards diversified services in each community clinic, where there doesn't have to be a lot of redirection outside the clinic services. So maternal mothers will come to the same clinic for their antenatal care, their neonatal care, their pediatric immunizations, their well visits, all the way into adult care, child and adult immunizations, school health visits, school medical visits, all in the same center. And all of those have a framework to be robust. And I think with time, it can be very robust. And that is public health in the framework, and particularly for maternal and child health. Thank you very much.
Thank you, Dr. Cooper. And now the floor is open for your questions. Rotarians, yes, you may ask questions of Dr. Cooper as it relates to the subject.
I see a hand up. Is that a hand up?
Good morning, Dr. Thurston. Great presentation. My name is Dr. Dean Wallace, Rashawn Dean Wallace. I'm actually from the Rotary Club of Nassau. I'm visiting today. But my question would be, seeing that you have the challenges, more so speaking to awareness, health promotion, psychological support. I know the in-clinic teachings are very beneficial to the parents. I don't know if there was anything in place prior to Dorian or COVID where we had like PSAs in the clinics, but now post-COVID, and with this new technological era, Is there something to consider PSAs or new PSAs to be ran in clinics and possibly Zoom classes for those persons who may have access to internet services to assist or to at least lend a helping hand with those persons that may be seeking some support and still has nobody to turn to? And these would be familiar faces that they have been coming to or seeing over the years. Has that been a consideration?
Yes, thank you, Dr. Wallace. I think those are fantastic ideas, and yes, those can be organized. Like I said, a lot of our manpower and a lot of our skills were redirected to the pandemic effort. But I think like I mentioned, that we're slowly getting on board. Particularly now we have some pediatricians and some doctors actually committed to our pediatric care. Yes, we can organize Zoom classes, and yes, we can now start to work on PSAs to be run in clinic. We've always had a TV in clinic, and we've always had that challenge of financing and organizing professionally done PSAs. And our way around that in the past has actually been to have a roster of physicians and nurses who teach at the beginning of clinic. Our pediatrician, I'll call her name because she's doing a great job, Dr. Janila Swan Miller. She's actually took it upon herself in between her patients to recommence her in-clinic teachings in the morning. But to be effective, and this is anecdotal, we don't really have any research support for this, but we do notice less questions when they do come in because they have a better understanding, less confused questions, I should say, a better understanding of what's going on, and more direct questions about their child's health when we do those in-clinic classes, those 15-minute talks, 5-minute talks, skits, and things were getting quite creative prior to the pressures and human resources pressures we've had. That is something I can submit. I'm the outgoing team leader at Flamingo Gardens Clinic, but that is something I can submit to health promotion as we start to normalize that we have our own public health PSAs, and submit to nursing staff, those who previously volunteered for breastfeeding classes, to start Zoom classes. Keeping in mind, we do have shortages still now because of our redirection of care.
Yes, I totally understand. Thank you.
Yeah, prior to that, these classes I might say were in addition to them administering care. And they were able to do this when there were less staff shortages for us to cover the direct care. And so we were able as a clinic to organize rosters. And this happened both at Fleming Street and at Flamingo Gardens and at the Blue Hill Road Clinic. So it will be some time, but I think you bring up a good point of establishing that framework and involving organizations as yourself in assisting us in providing reestablishment of that psychological support and health promotion.
Yep. Thank you. Are there any further questions?
Hello, good morning. I have a question.
Good morning.
Morning.
My name is Felicia Carey, and I'm a guest of Kemi Jones. To our guest, it was an awesome presentation. And I'd just like to ask, my questions are in twofold, actually. The first would be, what health services or programs in regards to teen mothers being not only diversified, but accessible, especially during post-COVID?
Okay.
And why I ask this question is I'm familiar with the adolescent health clinic that's off Shirley Street.
Mm-hmm.
However, due to the challenges that COVID-19 has brought, those adolescent parents who may be living in the Gambia area or the Adelaide area, who have not been able to access services due to the challenges of COVID, what is there anything coming on stream or being health services made accessible for them based on the challenges of COVID, instead of just trying to travel to the adolescent health clinic on Shirley Street, which is very far?
Thank you for that question, and you bring up a challenge. And to be truthful, as I'm aware, currently we have not received instructions regarding redirecting our adolescent care to anywhere else. We do see all ages in the clinic, all ages in the clinic, teen mothers included for their immunization and for their women's health, as well as ambulatory. So if it is an issue that involves them, they are not turned away. However, you do raise a good point that when they are in that antenatal period, they are separated into that adolescent health. And you raise a good question too. I was remiss in not talking about one of the major challenges in our antenatal care for our Family Island patients who are in a similar way, seriously and detrimentally inconvenienced by our protocol. Persons on the Family Island cannot deliver on the Family Island, and they are not allowed to receive antenatal care after 32 weeks, sometimes 30 weeks, depending on what is going on with the mother. This is a huge challenge. This is a major public health issue and a major issue, personal, psychological issue for these mothers. They must leave their island and go to either New Providence or Grand Bahama to receive the remaining of their care during this delicate period, where oftentimes if they don't have the finances to house themselves, must live with family or friends well into the postnatal period with their newborn, because we often do not recommend they travel prior to 1 month. And sometimes they do, they carry that infant on the boat because it can be so inconvenient or uncomfortable in that immediate postnatal period to live with persons, live under the kindness of somebody else, particularly if they have their own home in the Family Island. So yes, there are some major faults that kind of affect access to care. As we all know, we are in a unique situation in the country where we have to, it seems, duplicate what we have in New Providence on our majorly populated island. And financially, that is not feasible with our current budgets. And so some of these sacrifices are made, or these difficult decisions are made in the interest of safety for the mothers, where they have to be inconvenienced to come to New Providence. Similarly, in adolescent care, they are a special needs group of mothers, and they are inconvenienced a bit to have to go to Shirley Street. But what is set up at Shirley Street is a unique, seamless area of care where they may receive the care in the context of their adolescence, in the context of their where they are in their life, whether they're still students, whether they're still underage. And so they still have access. They still have access, although it is an inconvenience, they still have access. And with the adolescents, if it's not direct antenatal care, they can access their community clinics still. They're not turned away. We help them, we do refer them, but they're often assisted with whatever issue they have.
Okay, thank you for that question. Okay,
Thank you. That was a very good question.
No, my second question is, in the public sector, you mentioned psychological support services. However, just want to ask, are policies being amended or speak to the health services that teen mothers that can be able to take advantage of in every clinic instead of just the adolescent health clinic, especially those adolescent mothers who are post-abortive, whether voluntary or involuntary. But however, the challenge is that they cannot access these services without a legal parent or guardian. Is there anything in the works to make services accessible to them without their parents or guardians' consent, which may be needed?
Thank you again for that excellent question. You have touched on something that involves our legal system and involves a multidisciplinary approach to change. Our age of consent is 16. However, our protocols in clinic, our policy in clinic is that a child categorized as 18 must be accompanied by an adult. So we have this gray area in late adolescence where the law has decided that they are mature enough to give consent for intercourse, which means they can become pregnant. However, they are not old enough to access preventative care, prevention, family planning, postnatal, not postnatal, post-counseling, like you said, abortive, post-abortive counseling without an adult. Is there anything currently in the works? I am not aware. That is something that has been slowly dealt with, has stopped, been dealt with because it does involve a change in our legal framework. Currently, if you come in for a psychological service, that is also a major challenge because it is not as seamless as it can be. You have to be referred out of clinic. We do not have counselors or psychological counselors in the clinic at this time or posted to the clinic. Family medicine and DM trained family medicine and DM trained pediatricians. We do have some limited training in behavioral modification as well as the motivational interview. And we do our best at that time. We also are trained in screening for depression and screening for any mental illnesses. So once we have established that and a physician has recognized that, we try to keep them in as a routine patient so they can at least have continuity of care. Once we've decided that they need psychological intervention, we refer them to the adult CCAC where they have where now they have mental health services as a referral place. But you have highlighted yet another challenge where there's not that seamless movement where they can come to the doctor. We decide that this person needs some long-term behavioral modification or some long-term talk therapy within the clinic. No, they have to actually now go somewhere else to get that at a higher level. Family medicine and pediatricians, though, however, are trained to provide some basic behavioral change counseling and motivational counseling. Post-abortive care is something that we have not addressed in our framework currently, and no, I'm not familiar of anything in the works. However, we are addressing seamlessness in terms of access to counseling and access to adolescent health. Adolescent health also can provide that through that unit, but again, they have the inconvenience of having to go to Shirley Street where they can receive all of that in one place. I hope that answers most of what you were touching.
Yes, ma'am. Thank you so much. I appreciate it.
Thank you. Are there any further questions for Dr. Trustham? Thank you, Dr. Trustham, for your great presentation this morning, an excellent presentation. And thank you for giving us that valuable insight into how public health works. And now we'll ask Rotarian Kami to bring the vote of thanks, please.
Hi, good morning. So for Dr. Cooper, I definitely must say thank you very much for a very insightful presentation. I personally have a little cousin who's pregnant right now, so I often get roped into going with her to Fleming Street for doctor visits. So what you're saying is very useful for me, and I'm sure for other members in terms of what's going on right now, in terms of public health and what needs to be done to improve the system. So definitely thank you very much for your time and your very, very detailed presentation. And I'm hopefully we'll look forward to seeing you coming back to the club again, given that you know everyone here already, seems.
And I thank you very much for inviting me. Your topic was very broad and discussing the challenges we have, the strengths and the challenges we have in the system is not an easy one. But I just kind of want to reiterate, the public health system has an awesome responsibility. And as somebody who's been in public health for 13 years, I'm acutely aware of the challenges, but I'm also very much aware and proud of its strengths and the services they provide and the ability of persons to access that care. Yes, we've had setbacks, and the challenges in staffing makes it a little less obvious of the quality of care you can achieve, but it can be done. And I'm very optimistic moving forward that persons can come into their clinic with a smile, knowing that they'll get everything they need. And thank you
so
again
much.
for inviting me. I really appreciate it, and I enjoyed it this morning.
Please come again. And now we'll have the raffle. Secretary Donette.
Okay, thank you, President. Let me, 1 second, let me put this final touch on my raffle. And I will share my screen so that you can all share in the joy. All right, so. Okay, so you have 3 chances this morning. Let me put that up. 3 chances to win. I will start with the John Bull gift bag. I'm not sure what's in it, but I'm sure it's something nice. Oh, I don't know what it is, but I know it's something really nice. So here we go. And the winner of our John Bull gift certificate is Rotarian Rona. Congratulations.
Rona, congratulations.
So Rona, I have to remove you so you can't win again. And I'm going to do the Apple Watch dock, right? So if you don't have the Apple Watch yet, this is your start. Let's go. And the winner, Derek, we're going to ban you from coming to meetings. Congratulations.
Congratulations, Derek.
And I still have your other prizes, so I'm going to put them all together. And congrats. And the final one is our Starbucks vouchers. And I think it's a few vouchers that you can make multiple trips to Starbucks right after the Easter. If you haven't given up coffee, then you can go right during the Easter, as long as Starbucks are open. All right, so let's go. And let's see who the lucky winner is. So the Starbucks, I hope you drink coffee. Not, you'll have to give them to AG Carlo, but congratulations. Felix is always winning. Congratulations, guys.
Congratulations,
and
Felix.
thanks for supporting our raffle this morning.
Thank you, Secretary Donette. And now we will have the 4-way test by past President Leroy.
Good morning. Of the things we think, say, and do, is it the truth?
Is it the truth?
Is it fair to all concerned?
Is it fair to all concerned?
Will it build goodwill and better friendships?
Will it build goodwill and better friendships?
Will it be beneficial to all concerned?
It be beneficial
to all concerned.
Thank you for the final toast by Rotarian Melanie, Dr. Melanie.
Fellow Rotarians and guests, would you raise your mugs to Rotary Round the World?
To Rotary
around the
world.
Thank you, everyone, for your participation in this morning's meeting. Please note next week will be a closed meeting to non-members, and I wish each and every one of you a happy Easter. Stay safe and enjoy your holiday.
Thank you.
Thank you.
Happy Easter, everybody.
Thanks. Same to all.
Happy Easter. Happy Easter, everybody.
Hey, everyone. Have a
Happy-
blessed and safe Easter.
Happy Easter, everyone.
Happy Easter.
You.
Happy Easter, everybody.
Yeah, same to you.
Same to
Bye,
you.
everyone. And our meeting was recorded, so you can look at our YouTube channel. The video will be posted there later if you're a visitor and you want to share the meeting with someone else. Have a great day, everyone.
Have a good day, everyone.